Uh, order. Welcome to the first session of evidence for our inquiry on humanitarian access and international humanitarian law. We have two panels this afternoon, and we are going to begin with the first panel, where we have Steve Dennis, founder and owner of Steve Dennis Consulting, here in person, and we are joined online by Anna Tazita Samuel, who is Executive Director of Women for Change. And perhaps, Anna, firstly, I could invite you just briefly to introduce yourself, and then Steve, I'll ask you to do the same.
South Sudan. I'm Anna Tazita Samuel, the Executive Director of Women for Change, a women's rights organization in South Sudan. It's a pleasure to join you and to have. Thank you.
Thank you very much. My name is Steve Dennis. I'm actually the founder of Proper Support, and since 2002 I've been an aid worker. 2012 I had an incident of being attacked, shot, and kidnapped. I strongly believe in aid and believe security for our people is important, so happy to be here. Thank you.
Thank you. Well, if I could begin, Steve, with just asking you if you could tell us what did happen to you in 2012.
Right, thank you. In 2012, I was working in a refugee camp on the eastern side of Kenya on the Somali border. I was in a convoy. 5 of us were shot. I was one of 4 people who was then kidnapped. We drove until the car broke down. We walked through the nights and rested through the day. There was a militia some days later that rescued us in another gunfight. There was another person killed at that point. In the weeks and months afterwards, I was in quite a fog of disbelief and unfamiliarity. Previously, I'd run complicated programs, but I couldn't walk outside my house and in order of, it was very difficult. My organization initially did support me with some things, but then they left me off to the insurance company. The insurance company was quite inarticulate about what was required to get their support. They were extremely clear on what or how I wasn't satisfying their policy or their conditions, or just get us one more report and we'll get through to you. I was quite lost in that time. As far as an after-action review, things were quite lacking. The head of security was reviewing this security incident internally. He told me that because they didn't find anyone or anything at fault, there was no need to have an independent review of the incident. This was touted as the worst security incident for that organization, but because of no fault, no need for an independent review. I was quite lost with that. I was diagnosed with post-traumatic stress disorder and having a very difficult time. The discussions I was having on getting support and independent review in about 1.5 years after the incident died, the door was closed. I ended up getting a lawyer to help with that process, but again, it was quite difficult. I was diagnosed with depression around that time. Even my girlfriend had told me that you're not the person that I fell in love with at the beginning. 3.5 years into or after the incident, the case went before a court. The court did find the organization grossly negligent, meaning a heightened disregard for understanding the risks, putting measures in place, and post-incident support. This was quite a derogation from the residual risk that was initially concluded. I would say on impacts, the impacts are still there. I would say I'm much better with the PTSD and depression. I think that the remaining parts of that are quite counterbalanced with the insights this gives and the motivation I have to drive for change so that other of my colleagues don't go through a similar experience. I would say another impact that is continuing is I'm disappointed. I'm still disappointed that there's no process or structure that compelled the organization to go through an independent review of an incident that 5 people were shot, 1 fatally, 4 were kidnapped, and there was high suspicions of neglect for our safety. So that's one of the lasting impacts. Thank you for the question.
And have you had to manage your own sort of working through your physical and psychological trauma, or have you had specialist help?
Well, yes, I guess there's somewhat 2 areas of focus. I was shot, so a physical injury, and I was heavily traumatized from the violent attack, the violent rescue, the hopeless middle bit. With that, I guess with the medical side, it's I felt that I had to navigate the system myself. What do you need is not the type of question to put to someone. I needed somebody to help me understand what I needed. Also, to walk through the medical processes to get a decently complicated injury assessed and treatment plans put together with no certainty that the insurance would cover the bills, as well as the continually erosion to my savings. It biases your decision making, and also you're in a fog. And I really adhere to that description of unknowing where to put your step to go forward and in which direction. As far as the psychological injuries, PTSD and depression, I have a very good trauma psychologist, so this is his specialty, and I'm very impressed with that. Going from being hypersensitive, highly triggered by small things that used to be very familiar to me in my hometown, to understand what's happening, the tools to minimize them, the ability to fix, manage, or avoid. Insights like that were very good. However, there was another injury that started to come up, I would say a moral injury of a diversion from the vision of we will support you to having to prove not only guiding my treatments, but having to prove that the injury is real. For instance, 7 reports from different psychotherapists, psychologists, psychiatrists were not good enough for the organization to take on. He's diagnosed. It had to be a court-appointed psychiatrist who was the 8th parallel report on that diagnosis. Similar with medical things. So that burden to people to, well, myself and speaking for others too, to have to prove the injury beyond reasonable doubt as opposed to take that burden away. I like the analogy that if somebody is in a coma, they can't do anything, but if somebody is conscious but just heavily traumatized, that's a horrible situation to go through. There is a cloud of darkness around. Your decision making isn't the best. Your abilities to plan and run things is not as it used to be, managing programs in highly complex areas. So that was, I'd say, a difficult part for me. I still see my the people for my leg, my physiotherapist, osteopath, and chiropractor. I still have contact with my psychologist. There are some impacts. The moral injury, I would say there's still disappointment that when I hear other colleagues who are up against an impossible burden to get their injuries listened to and addressed, when they have to become the specialists themselves, it's a burden that's too far.
And do you think that the approach to employee safety taken by donors and employers has changed since 2015 when you won your court case?
Well, you know, I'd like to know, 2015, yes, it was the court case and the verdict. I would say there are hundreds of people that have approached me saying that they either have changed their behavior, their organizations have changed, psychotherapy, counseling services, security consultancy services, insurance companies. Hundreds of people have told me that their perspective to risk has changed from the verdict. 2012 was my incident, and I can't recall one person who has told me that my incident has changed the way that the security is managed in the world. Since my incident, there's been about 1,500, according to the Aid Worker Security Database, about 1,500 other people who've been kidnapped. And I would propose here that my court case, and I'm certain some of my security colleagues behind are agreeing, that my court case has had more of an impact than the 1,500 other people who have been kidnapped. If you look at my testimony of hundreds of people, that security has improved because of this external independent review and some accountability of security, I think that goes to show that there should be more independent review of incidents. So I think it has changed, but it's the court case, and it's the only court case that I know of in those almost 10 years from now.
And before I was an MP, I used to work in your world, so I'm very interested in the issues that you're raising. I'd be interested to understand, when you were initially working in that situation, what sort of steps your organisation took to prepare you, or firstly to sort of assess and analyse the risks, but also to prepare you for those risks. So, what if any risk assessment was in place?
Right. Now, the verdict was gross negligence, and what that meant is picking apart everything that should be in place. There is a high derogation from that. So looking at training, it's a high-risk area, the highest category of risk for that organization. They had a top training, the hostile environment awareness training, but nobody there had done that training. The security managers who are to put in place security measures, they hadn't done training on management. The head of the crisis team testified in court. What crisis training did he do? And he talked about personal training, when bombs are going off, lay down, but not to manage the process of setting objectives, resourcing, and communicating. I would say that from the organization's perspective, the verdict's there, and it speaks for itself on any aspect. Security plans. Well, yes, they had just been updated. Well, did you follow them? No. The big part there was that came out in the review was that the security advice and the security advisors were cut out from the security decision making. Now, I guess this comes a little bit to an inquiry question of what can the government do to hold perpetrators accountable for atrocities to aid workers? And I would say that it's not only the perpetrators, but it's the organizations that train, prepare, give equipment to, and really promote that culture of security and safety awareness. That should be looked at too. In our regard, it wasn't the organization that shot and took us, but there was a role. The verdict does get quite clearly that reasonable measures were not put in place. So there is a gold standard, absolutely. I'd like to refer to other security colleagues or the written statements on what's required, but this is the only real independent review of a situation. And I don't think of those 1,500 people who've been taken after me, there's been a review. And it is virtually impossible to bring a case forward. This burden to be put on somebody who's heavily traumatized, just trying to get through their day, just trying to figure out, is it an orthopedic surgeon or is it a physio? Who do I get to help out with a leg? That's an impossible burden to be put on people suffering from these things. So as I said before, disappointed that there wasn't a process to compel independent reviews.
So it's not just the aftercare then, there was very little training beforehand, little awareness of amongst staff of the situations that you might encounter.
Right. Yes, and to echo on that if those things do move the odds in your favor, then we have to look at, were those in place after an incident does happen? It could be a bombing from artillery. It could be one of these things. But was there appropriate training or not? Aid workers also go into Ebola areas, pre-training equipment, measures. If somebody dies of Ebola, you can't just say perpetrator Ebola. You have to bring out, was there appropriate measures? High-risk environments, disease, or war, there's a structure of assessing the risks, managing the risks, and then should it happen, the comprehensive post-incident care, I think, is the phase of the pre-incident. If a treatable injury is not treated, it becomes permanent. If the permanent injury leads down to hopelessness, we do know colleagues, every aid worker knows colleagues who have taken their lives. And there aren't many studies on it, but we know. So protecting aid workers should extend as well to that post-incident area there too.
Are you still working in that world?
So I run a service now. It's called Proper Support, where is a non-profit, and we work with people who have fallen through gaps. So aid workers contact me. The case got public. A lot of people contact me now saying, I've been injured, I'm lost. So I help people navigate that space. I build a team of psychotherapists and doctors and often lawyers, because if there's a wall put up between them and proving their injury, it's not fair. It's not a good business to be in, I would say. So I'm actually trying to be the support that I wish I had through my thing. So yeah, and in fact, I would like to work myself out of the business. Some accountability measures being brought in, absolutely good, and work me out of it. Yeah.
Thank you.
Yeah, thank you.
Monica.
Thank you very much for sharing your experiences with us. I wanted to ask about the public perception of what you went through and about aid workers generally. What did you receive any public sympathy in a kind of wider context?
Yeah, I think there's different elements there. Sometimes soldiers get this as well, that, you knew what you signed up for. And it's true. And as I was being taken into Somalia, there was a moment of thinking, I might not get out of this. This might be my end. And no regrets of the work I've been part of for the decade before then. Yes, knowing what we went into is there. But when you peel back a review of, wait a minute, I had trust of the security measures were in place and decisions were weighed nicely or weighed properly. So finding out later that security advisors were not involved in the decision to remove our armed escorts. That's a security decision. You'd want security people to be involved. So finding out afterwards, I was pushing back to some of that public perception of, you're signing up for, what are you complaining about? It's like, I'm actually interested in the sustainability or the continuity of aid work, because I'm very proud and insistent that it has to continue, but the way for that to continue is to keep aid workers safer, and that can only happen with independent review. I think as societies like the UK here honor their military service that goes, thank you for your service, putting your lives at risk. A lot of aid workers do a similar type of sacrifice away from home at high-risk areas. There's a different perception, I think, there. There isn't a cohesive organization taking care of aid workers because they might go from different contracts of different nationalities. Definitely locally employed and international aid workers are sometimes cared a bit differently. One thing that I think the government can do is, like the measures of prevention of sexual exploitation and abuse, policies that are in proposals and requirements to report on issues of fraud and corruption, there should also be safeguarding measures required in there. Incidents of your staff, injuries, illnesses, deaths, kidnappings, should be reported, and there should be an area for independent review there. Not just the organization has been able to mark its own homework and giving itself a passing grade, like mine was. I would say other things, public perception. I think sometimes people lose track of what aid work is all about. I think there's definitely an amount of solidarity with people going through disaster, either through an empathetic application of, I'm empathetic, we have resources of people and money to put to problems, or if disaster happens to us, we would also like others to be in our assistance, or just the pragmatic. The Ebola outbreak right now in Uganda, there's a direct flight from Kampala to Rome or to London. There's a pragmatic reason to stop diseases where they are if you have no other reason to do aid work. I think some of that is lost, and so some of the public impression to aid workers is also lost. Lastly, I would say, for me to challenge the aid organization, to take them to court, I think was seen quite negatively. And I don't mean to say that there is negativity of that organization or this independent review. I just mean to draw the curtains back and turn on the lights, what happened, and don't let it be the same people who are involved in the decision making. There could be bias there. Marking your own homework, the grades are higher. So I do see a role for government to be there in an oversight of some sort, not too much, but in some sort, to ask questions. These aid worker deaths and kidnappings and injuries, numbers are going up. Is it only the perpetrators, or is there some role of others? The 1,500, I was the only one that brought it all the way to court, and I found that it wasn't just the perpetrators. Yeah.
Can I just push it slightly further on that?
Please.
I was really taken by your comparison with the military. Do you think that aid workers, the public loses a sense of their nationality because they're working in an international context or for an international NGO? Is there therefore a slight, what's the word for a detachment from aid workers, and that there's not a public perception of what good they're doing or for the country, for the donor country, for example?
I think so, and I think that's all right. I like the idea that aid is independent of any political influence and impartial to the designs of interest. The needs are there. Out of a solidarity. I think there's agreements of international humanitarian law, of the rights of people in conflicts, and the assistance that should be there. And I think rightfully so, it should. The UK has a high reputation in the world of the delivery and the solidarity, even when it was just outside of its direct interest. I think that's lost and it's losing, and this discussion right here is relevant, and that question is very relevant these days. It should be separated from political things, but society is better when $1 of aid can avoid a military intervention later when people are disliking a political situation there. Focusing back to aid worker safety, and one point of mine of the reducing budgets and the relevance to today's situation, when you don't have time for maintaining your broken car, you do the oil change and you make the repair. When you can't replace it, you do the repair. When you can't recruit and replace experienced aid workers, you focus on the treatment and the post-incident care. But, I diverted a little bit there, but please follow up, and please dig deep. This is a good question you're asking, and that's where the learning is.
Thank you, Steve, for sharing your very powerful and difficult experiences, and for those really concerning reflections on the broader context. And turning to Anna now, just wanted to know if you could describe a bit more the work that your organisation does and some of the threats and challenges that you face.
Thank you so much. Once again, good evening. Women for Change is a national women's rights organization in South Sudan that has been founded in 2016, and of course we officially registered in 2018 with the main mandate to empower women economically and socially, looking at the historical background of how women in South Sudan have been treated. We are operating, of course, we are doing basically 4 things. That is the thematic areas. We have the economic empowerment of women, where we do a lot of income generating activities. We do a lot of FSL and education, and we do protection, that is gender-based violence and child protection, including gender protection, where we do programming, response, and management. And right now also we are doing coordination as the only women-led organization coordinating the GBV subcluster at the national level and also at the state level. We also do peace building and advocacy, looking at the continuous conflict in South Sudan, intercommunal fights. We needed to empower the community on how to really manage themselves, or how to live in peace, and how to manage some of the conflict that arise in the community among themselves. And yes, basically that is what we do in short. And of course, we are also in different networks that include the START network. We are members of the START network. We are members of the C4C, that is Charter for Change. And then we are also a member of the Localization Working Group, where currently I am the chair and co-chaired by Save the Children. And we are also members of work leading from the South Consortium and very many areas. Yeah, of course, we are working with the refugees, and as Women for Change, we work with the women, by the women, and for the women. And looking at the current situation in South Sudan, with a lot of influx from Sudan, the returnees, we call them, we have returnees. Of course, we are having South Sudanese living in Sudan. We have the refugees, the Sudanese coming to South Sudan. We have to also take care of them. So we working with the refugees, of course, there are also a lot of challenges that are just I'm driving to the challenges that we face as a local actor in the context of South Sudan. As a national organization, of course, the community looks up to you to be the first respondent on ground. But unfortunately, it is sometimes you can't respond due to some financial crisis or logistic crisis that you cannot be able to support. And when you also reach out to the other agents to support you with the supplies, it's a long process. So that is one challenge that we face. And then, of course, the challenges of accessing decision-making spaces is one challenge that, as a national organization, it's really tricky. Decisions are made at a different level, and as a national organization or a WLO or women rights organization, you don't access those decisions. They are just passed to you to implement, and it becomes very difficult sometimes to share your views, because you don't have the space to share your challenges there, as it's dominated by mostly the different agents, the international agents, and then also the UN, especially in the cluster system. And then, of course, operating in South Sudan, we operate in, like, for example, Women for Change, we are operating in Jongole State, in some area called Fangak and Warab states, and Central Equatorial State. So we operate in areas where sometimes there are crises that will come, especially communal fights that will erupt in the middle of the night. And we need to evacuate staffs from there, away from the field to a safer place. It is sometimes it's very difficult for us because we don't have budgets for them, and in most cases, the projects that we have, we are not given security a percentage. When we ask security, like some money for security for our staff, they will tell us, you are local actors, you don't need security. Security money is only given to international agents. So those are the challenges. It leaves us in a very difficult situation to really support lives of people in the field. And then also, when you send someone there, you need to be ready to really have enough resources to evacuate, because anytime any minute conflict will erupt out in the community. It's not about maybe political or what, but intercommunal fights that happens, and that is the most difficult situation. And sometimes floods come and they start covering the whole place, so we need to also So that is one challenge that we really face as national actors and especially as a women's rights organization in the global south and like a country like South Sudan. And then of course we also have other challenges like very limited or short projects given to us. For example, we are given a project of 3 months or 6 months to implement, and that is the time you are trying to really be helping the community so much, and you already receive an email that you have to submit end of project report. So it creates a lot of conflict with the community. The community feels you are the one delaying to respond to us, and um, when we really are not the one who are delaying, but sometimes the delays come from the intermediaries that are also giving us the money, of course. And then there also the lack of accessing funds directly from the back donor is a big challenge because the money comes through the intermediaries. And sometimes there are delays. The bureaucratic system also happens, and it really affects the operation on ground. For example, a project supposed to start in January. Up to now, we have not started the project, and it's ending in December. So it's just because we have to wait. Also, the intermediary have to finish their logistical process. Then, by the time the money is coming, the first quarter is gone. So we are looking at now 3/4 of the year. And the unfortunate part, they will ask you for report of quarter 1. Report of quarter 1 is not there. So it is a very difficult situation that in most cases we are put in as local actors. And for example, I can talk on behalf of Women for Change that it's a very difficult situation, and it's a very big challenge that sometimes you end up urging, you ask, why is the project delaying? They'll ask, we are doing our logistical challenges. And when you push so hard, the next thing they said is, you are not a cooperating agent. So the next year, you are already dropped out from partnership with that agent. So, it's all a lot of stress and a lot of, I don't know how I can put it, but the bureaucratic system is a very big challenge that we face, and also other local actors face in South Sudan and also in our context.
Thank you, Anna. So could you describe a bit more the kind of impacts that can have on you as individuals in your own lives, your physical and emotional well-being, and a bit more about what you've talked about there? The stress.
One immediate effect that always affects us, especially those for us who goes to the field, is the emotional stress and the psychological stress. Sometimes we have a lot of stress that are associated because sometimes even trauma. Because I remember one of our staff, there was just an abrupt intercommunal fight, and in the middle of the night, all the people evacuating their staffs away from that location. And me, as being the head of the organization, I have to be called the night to look for how this staff will come out, because now here we are saving life. The staff on ground was very stressed because he has to be staying underground for about 4 days without water, without food. So that is one thing that really is affecting us so much in the stress, the psychological stress that is associated with our work.
Yeah. And do you feel like you're getting enough support? I mean, how do your team sort of put in place, I guess, mechanisms to deal with that stress and those challenges you're facing?
The strategy that we are using, we have adopted as Women for Change, is that we are working so closely with the South Sudan NGO Forum, which has the INGOs colleagues, and then also the national organization colleagues. And in that, when there is anything, we reach out to them and ask, please, there is this how can we get some help? And with the South Sudan NGO Forum, they are very quick in sharing information. Sometimes we find that maybe one agent is already is saving their staffs from that location, and we shall just add something small, and we shall tell them, please include our staff to come together with their staff. So working in collaboration is one thing that we have adopted. We don't want to work alone. We want to work with the bigger community, and that is one thing that also have helped us a lot. And another thing is, of course, when the staffs come back to, or if something happened, we allow them to go we give them a stress management session, and we also allow them to go home for at least a period of 1 week off work and just relax, and to see that you can really, your emotional, your psychological well-being can come back, as we also check on you and see how you are progressing, and maybe also connect to some of our colleagues who are offering psychological support services. And this person can really be going through those services, and we see that by the end of 1 week or 2 weeks, depends on the magnitude of the event that has happened, we give it to you, and by that time you come back when you're already okay, and we keep supporting you until you recover fully, and we move on. But as local actors, we are also resilient. So whether something happens, sometimes you find that when you send the person home, the following day the person comes is saying that if I stay at home, it's more stressful than me staying in the office with the colleagues. So we find ourselves working throughout.
So do you think it sounds like it's discouraging people from coming in to work in your world, but do you find that it's discouraging your close colleagues locally from actually doing the work?
I can categorically say that it is not this. These are our people. These are our own people. If we fail to serve them, who will serve them? You see, at the end of the day, we have to serve our people that are in the community, that are hard to reach. So most national organization or local organization in South Sudan are not really giving up, despite all the challenges, despite all the crisis that they go through, but they are still committed in serving their community. And when given support, they are always there, and they are always the first to reach to the ground to support their communities. It is actually giving us more strength to serve the community than ever the challenges that we face.
Yeah, I understand. And lastly, you've described some of the support mechanisms in place, but do you feel that they're well resourced enough, and do you feel that you're getting the support you need from partners and your donors, for example?
From a local perspective, working together with the counterparts, with the NGO Forum, which has different agents, it's a number one remedy to solve urgent crisis that happens on spot. However, in a long term, there is not enough support, because at the end of the day, you need resources, even for NGO Forum, South Sudan NGO Forum, to support you. At the end of the day, you need even a security personnel who will be advising that, okay, today the context is like this, tomorrow the context is like this, because as the other staffs, everybody is busy with their projects. For example, myself, I'm also busy with also sometimes meetings or with other things. So it is very hard for me to be concentrating on security matters, and somebody also when there is no really dedicated person. So sometimes security issues we are taken by surprise. You see, unless we have to receive a message from maybe South Sudan NGO Forum to see that there is security problem. For example, in Yei. Yei is a county in Central Equatorial State. But if we have security focal persons like most international organizations have, and even the donors, we can get first-hand information. And by the time the secondary information is coming, when we have already prepositioned that there's something happening like this, there was already a plan, and we can easily save our lives, or we can easily evacuate, or we can easily have a mitigation measure to that crisis, other than waiting until it's now a secondary information coming from outside, and like you are working in the dark, which is a very big challenge. And that is because we do also, as I mentioned, we do not have mostly the donors do not support security focal persons for national organization. So maybe one thing I could recommend is if donor could support security focal persons for local organizations, it will be very grateful. Excuse me.
Mr. Dennis, I think you wanted to say something.
Yes, and I hope you don't feel that I'm overstepping, but I spent a year and a half in South Sudan and Jonglei province, so I think I can say this with some authority. I want to emphasize some things that Anna brought to the room here. You were talking about when an insecure situation arises, and just picture yourself in a small village. Gunshots go off, then more, then your dinner stops. People see people running. You get what you can, and you start running away from the gunshots. And Anna's probably thinking, as a leader, is my staff safe? Are my family safe? So a burden that a lot of our local staff are with. And then, fine, you're out, people are safe, the situation has gone away. Then to realign, and as a leader of an organization, to focus on the objectives of the organization, to make meaningful life-saving improvements to people's lives, life-saving interventions. That is a hard skill for somebody to go through. It doesn't come by coincidence. I think the resilience of a lot of people is one thing, but resourcing that. This is donors looking beyond just the project, but funding the organization, and for these elements of increasing the capacity to manage one's stress through those things. Your heart goes through your chest sometimes when the gunshots are too close. So to manage that, set priorities and get through, and then the next day to have a staff meeting. Is everybody okay? Let's focus. How is our quarterly report going? That is a high skill level that people like Anna go through. So thank you.
And do you think, I'll come back to you, Anna, but do you think, Mr. Dennis, that the government donors like the FCDO or other donors could do more to support the safety and well-being of staff delivering UK aid?
Yes, I think there's an opportunity on the three elements to that. One, the expansion of accountability has to be expanded as well to look at aid organizations, their accountability. Secondly, the comprehensive post-incident support. Acoma, we do everything for them. Heavily traumatized, we have to do a lot for them, and we're not. We're failing there. Thirdly, just as prevention of sexual exploitation and fraud and collusion in the proposal time, asking about staff care, asking about incidents, that's there. To get guidance, there's interagency security forums that we know of that have great advice on these things. The knowledge is out there and the insights are out there as well. I'm sure Anna would welcome anyone from this committee to visit, to see it themselves, to ask these questions. Because I do think this distance, you don't smell the reality as well as the majority of the aid workers are experiencing there. And sorry, none of what I'm saying has any differentiation where a person is coming from, internationally or locally applied. Reasonable measures, foreseeable risks, it's for locally or international.
Anna, is there anything you'd like to add to that? And then I'll come to you, sir.
I wanted to add to the question you asked Stephen. Yes, I strongly feel that donors like FCDO can do a lot. For example, I just want to give an example to this house that from 2021 to this year, 2024, we have been having a project funded by the FSDO through the CSSF department and through international organizations like Safer World and Women for Women. In that fund, it was a flexible fund supporting women's rights organization in conflict-related areas. In that fund, we were allowed to do anything with that money. And I wanted to say that because of that money, that grant that we got from the FSDO, the flexibility, we were able to evacuate one of our staff from a very dangerous place, even out of the project location. You see, so that is to mean that when donors give money for projects, it should be flexible. There should be flexible that the local actors should be able to use that money beyond the project objectives, and that really can strengthen the institutions, and that can save life, that can reduce stress management, and we can reach to very many people. Really, we can save life of very many people. We can improve delivering of aid, and that also comes the proper accountability to the money that is given to local actors to implement through intermediaries.
Yeah, I think Steve was making a really interesting point before, and that sparked a question really, which is, in your experience, do you feel that there is a difference between the way that local and international staff are treated by an international NGO in relation to risk? Mr. Baker.
Answer yes.
Yes, of course I'll say yes, Anna. There's often differentiation, of course. Sometimes if a risk assessment is not done properly, the assumption would be, you're from here, you know the risks better, you can do it, whereas internationals might be pulled back. Whereas actually the opposite might be true. I've gone forward where people from that area actually are more targeted, and that's an inappropriate risk thing. Also, I would say on post-incident care, the ability to navigate systems might not be quite so easy. I had many more safety nets than my colleagues that were locally employed, and many other resources to forward my grievance of asking for an independent review, many more. So I would say yes, the areas are different, but I think proper risk assessments are important, and inclusive risk assessments. How do you feel about that? Generalizations are dangerous in a lot of ways. Yeah, but I really want to hear from Anna as well on this.
Anna.
Yes, thank you. I think I will not really say much apart from what Stephen has said is correct. I will typically talk in the context of, let's say, East African or in South Sudan, international staffs have more safety packages than local staffs, I can say. Even if they even work in the same institution, in most cases, they are not treated the same. So it becomes a challenge. And then when, if, for example, when crises happen, if there's evacuation, it's always the international that are evacuated first. Then the nationals are left to mitigate around with the conflict that is happening. And you see that it's the same contract we sign. So I feel it is sometimes, in 80% it is unjust. But of course, as Stephen said, it depends on the context, because even in South Sudan, there are areas where specific individuals cannot go there, even if they're South Sudanese. They cannot go and operate in that location. If they go there, they become more risky. So their risk package is also different from another South Sudanese from another area to go and work in that location. So yeah, and I think when sometimes we ask also, they said, it's the donor policy. The donor gives more security packages to the international staffs than the local staffs. So again, the ball comes back to the donor, what they do on ground. Thank you.
I think I appreciate that.
One last part of that. In a conflict, often people not from one side or the other can cross the front line, and that's an important thing, or say something, whereas somebody else from that area can't as well. But again, risk knowledge is important.
Monica.
Can I ask, do you think the impact of cuts to USAID and also from the British assistance is going to impact your security or the security of aid workers, in that the efficiency savings will be such that they will want to go into the programme rather than the security of health aid workers?
I think it's thrown the whole industry in turmoil, and for people to get back into a steady state and then to figure out the nuances, it will take some time. I think there will be a lot of problems in this turbulent time until we get back to a new normal. And I hope that the concept that when you don't have a lot of money, if you invest in better risk management, so there's less incidents and less post-incident care, but when you are doing post-incident care, it is better, so you don't have false starts on treatment, and you treat things so that they're not permanent, and you don't lose that experienced aid worker and you have to recruit another one at a lower level of experience and figuring things out. So I hope that's a concept that floats to the top of this discussion. But it's horrible what's happening, firstly, to our beneficiaries, and then to safety. Absolutely, there are many impacts of that for sure. And sometimes staff care is considered a luxury or a thing on the side. It's not. I've ended my field career. I do not go to the field anymore, and I can run good programs. I used to, and there's just some things that I can't do anymore. And that's a shame that this resource is out of the game. You got to train somebody else up, and that's expensive.
Thank you.
Yeah.
Anna, is there anything you wanted to add to that?
Just to say that the cutting of fundings from the USAID and the UK aid has really affected us a lot, especially national organizations. And one thing that has right now, as we are struggling, as I talk to you now right now, is my staffs are in the field trying to explain our position that we are not able to deliver these services to this community because the funding has been suspended or has been cut. So it's a whole of struggle. The community do not understand what is happening outside. What they know is that there are governments outside supporting them because they are refugees, because they are returnees, and because also the current economic situation in South Sudan, it's very there that people look up to the angels or to the aid that the governments support the community with. So with the cut, right now we are facing a lot of security risk from the community. That is one thing. Another thing is a conflict between the community and the institution. Like right now, we really, like as I said, I have my staffs on the ground explaining. Since at 1 p.m., they are still explaining themselves. We are explaining our position that we cannot offer this service. They're asking why. They are saying we have eaten the money, and they come to the office and say, this project, we need the money. Why is it not going through? Why are you not coming to us these days? We are dying. Our children are dying. So it's something that has really put us into a very big position of explaining. When you said, London has decided to cut the fund. Washington has decided to cut the fund. They'll start asking that you are speaking a language that they don't understand. You see, so it's a very dire situation at the moment for local actors like us, we are just trying to mitigate, trying to balance between the realities and the like assuming it is things are going to change, but the reality is that funds has been cut. We were first jubilating that if the US have cut their fund, the UK aid is there. So UK aid has been supporting South Sudan quite some time, and a lot really. Now, when we also saw the news that UK aid has also reduced the funding or have cut the funding, it really killed most of us, if I can use that language. You just can't imagine the next day what the community leader is coming, walking into your office and asking you questions, and sending staffs also home, because at the end of the day, you don't have salaries to pay somebody. So you send somebody home who has children, and this is the only job the person is doing with the current situation in South Sudan. We have instance like some of our colleagues in other organizations, the staffs want to commit suicide. I'm sorry to say this, because they are sent home. There's no means, and you have over, in the African setting, especially South Sudan, I can only have a family of, maybe I have children of only 2 children, but I take over 15 care of 15 children. So you see, all the whole external family is just looking at you, and you are seeing left, right. There is nothing. The only means of your survival is being taken away. So it's a lot of issues that right now people are struggling with, especially in South Sudan. It's a crazy thing, and yeah.
Thank you.
We are navigating how to go there, and especially for us who are leaders, you end up having sleepless night thinking about what you do, how you send someone home, of course, the realities, but what next is that person going to do is the challenge, because the economic situation, the political situation is not favorable for someone to survive without work.
Well, thank you very much, Anna, for joining us today and for your contribution to our deliberations. We are very grateful for that, and we're very grateful, Mr. Dennis, for you joining us in person. We'll conclude this first panel of our evidence and move to the second panel. Thank you very much indeed.
Thank you.
I just check, Ms. Ross, that you can hear us.
Yes, I can. Yeah. Right. I hope you can hear me clearly too.
Yes, I think we're happy with that. So I think you're aware that we have 2 people in the room, as well as you joining us online. So the questions will move between yourself and the people in the room on the panel. So I'll begin by asking you if you could just introduce yourself, and then I'll ask Ms. Wall and Mr. Novakovic to do the same.
Great. Thank you and good afternoon, everyone. My name is Tarini Ross. I'm head of humanitarian programs at an Indian nonprofit called Humanitarian Aid International. We also represent a coalition of 22 grassroots organizations in India called Local. It's a non-financial platform to strengthen the frontline response mechanism. Looking at issues of safety. Who are also playing the role of frontline workers. And recently we also undertook a global study and conditions of humanitarian frontline workers and disparities in our sector, where we 60 countries, and that is also.
I am an independent consultant now. I worked for about 15 years in the front line of the aid world, mostly for the UN, mostly in humanitarian, so frontline sudden onset natural disaster response. I now based in the UK. I work mostly in mental health. I'm a qualified therapist, mental health first aid instructor. I'm also in the interest of transparency, on the DFID roster, I do FCDO roster. I still do some HSOT contracts from time to time. I'm also the founder of a online community for aid workers called 50 Shades of Aid that's been running for about 10 years and has about 27,000 members. So I have worked now for the last few years providing psychological risk management, mental health support services to private clients, but also to organisations across the aid sector within the UK and beyond.
Mr. Novakovic?
I'm the Executive Director of the Global Interagency Security Forum, which is a UK-based network of over 130 INGOs, and we work to bring the NGO sector together to advance safety and security through collaboration, knowledge sharing, and capacity strengthening.
So can I begin, Ms. Ross, by asking if you could describe the sort of threats frontline workers face as they deliver humanitarian assistance?
Thank you for that question, and I will also be sharing not just our local perspective. Local frontline actors, they face risk every day. From the figures we have, in 2023 alone, there were 595 attacks on frontline workers. 96%, less than half of them have any access to basic security infrastructure. We also alarmingly saw that, when it behind. Other than just conflict settings and the risks of armed groups and armed violence, we are also seeing that the risk expands to climate-related disasters as well. Health risks. Affected communities are also exposed to the same risks in terms of poor living conditions, poor infrastructure, and limited access. Kind of resources and support maybe their INGO counterparts get. A lot of overworked, understaffed organizations because of resource constraints, and now we're seeing globally the trend is to towards support. Even in terms of mental health, 78% of the frontline workers we surveyed said they were suffering from chronic stress and PTSD. And less than 15% had access to mental health support by their organizations and employers. Even specifically for our context, the main issue they are also dealing with is income insecurity, job insecurity, and almost no social security. So we have people who are on the front lines risking their lives, but also have to think of their own basic survival and how they'll manage to feed their own families. So we have a lot of local colleagues who are doing two jobs. One is just based out of their passion, they're serving communities, but they also have to do something to earn an income to get, through managing their own costs. And even in terms of social security, we saw that only 12% of frontline workers had any kind of life. Aid workers were experiencing sexual harassment or assault. But also something I think that we heard from Anna and Stephen, just in terms of reinforcing it with the figures that came out from the study.
And what challenges do you face in trying to support staff recovering from what they've witnessed and experienced?
So there are, I think, several challenges at several layers. One is that a lot of the partnerships local organizations have are with INGOs and intermediaries. In these partnerships, we are seeing they're not really partnerships. They're very inequitable in its structures. Local frontline workers are treated as cheap implementers or just delivery agents when it comes to aid. So they don't really get the support costs. And I can give you one example in COVID, when we were responding ourselves and our frontline workers were dealing lockdown conditions biggest INGOs, and we asked, can we make some allocation for at least operation costs, let alone safety, security risk? And they said they had no budget to share with local actors. But, they had a budget to send 2 professional photographers to cover prioritizing whose lives matter most. And what we're seeing is like local frontline workers are being treated as dispensable workforce, because in these partnerships also we don't really get security budgets, so we have to dip into our overhead if at all we get it. So what we've been trying to see is that can we have a model where as we can support low cost, no cost solutions to frontline workers. So under our local coalition, that coalition, irrespective of whether they were local staff, whether they had any staff contract or not, or even if they were community volunteers that were engaging just for 1 week for aid distribution, we covered 1 year accident insurance for them, and we were able to do that at a very low cost. It just costed us $14 to get a cover of 5 lakh Indian rupees. And that's something that we're also asking and encouraging local actors to prioritize, that we can cover it for 1 year, but next year demand it from your donors, from your partners, to include.
And you've already, I think, made some reference to it, but what is the difference between the threats that men and women face?
Of course, particularly in terms of gender-based violence, like I mentioned, 1 in 3 female aid workers reported facing issues of sexual harassment or assault. And for that, for instance, with local organizations, because we don't get overhead costs, a lot of us struggle to even have HR personnel full-time. And because we don't have that, we don't even have proper systems yet. There's not really much investment in staff welfare, in staff safety, in sexual harassment and dealing with that as well. So that's, I think, one particular issue that comes up for us as consortium. What we did is that our support for our local members. So we said, instead of 22 organizations struggling to manage budgets, salaries for HR people, can we provide centralized support, at least to share policies with each other, share support, linkage whenever that's possible with each other. So that's how we have been dealing with it, without any separate budgets to deal with such situations.
The picture isn't working too well in terms of broadcast quality. So we're going to move just to sound only in relation to yourself. So, but we can hear everything that you're saying. But we're going to just have audio rather than visual, because the picture is not good for broadcast quality. So I hope that's okay, because I have a further question, and then my colleagues will have further questions for you. So what you've described, what of the challenges on actually delivering the aid that you're looking to deliver?
One thing specifically we are seeing, is more and more issues of brain drain. Those that are on the front lines, because of all the challenges they have to face just in terms of survival. 1 in 5 said that they were thinking of quitting the sector altogether. Conversely, we see that it is community volunteers who take up this role. It's active youth from the communities, members of sports clubs that are also playing the role of frontline workers. So they remain committed and continue working in very hazardous situations. There aren't really there isn't the guidance, say, on withdrawal or evacuation wouldn't even apply to them, because they are from the communities itself. Where would they go? That would be like displacement. So particularly we're seeing that's one thing that we've, even with local organizations, we've had to prioritize community needs, sometimes over the safety of staff, because resources are so limited. We are trying to ensure that the maximum reaches communities, but that's something also very challenging, is that, if you're as even it's our responsibility as frontline organizations to ensure we're doing as much as we can in terms of our duty of care, because we can't expect frontline workers to deliver quality aid unless we're taking care of their other needs. We're not just expecting them to deliver aid, we're expecting them, to support community-led initiatives to actually address the conditions that are creating, vulnerability or sustaining conflict. We're expecting them to do much more than that. So I think that's one of the main challenges, is that if we lose these kind of frontline workers, we have to go back to hiring other people, retraining them. So that's I think one of the most critical challenges we are facing.
Thank you very much. Monica.
Thank you. I want to ask a question of everyone, if that's okay, and I'll start with Ms. Ross. In your experience, how responsive are donors and INGOs that you work with to the security and welfare needs of local organisations? Ms. Ross, if you'd like to go first.
With donors, unfortunately, we're seeing that this is not a priority. With security support, it tends to be tied to project-based funding, which are very short-term. And that's something we're challenging, is that we're not just looking at financial support, but even going beyond that. Because risk doesn't start and stop with project start and stop dates. So I think that's one place, that for donors to look at it not as an additional cost, but as an investment in terms of quality of aid that's being delivered, in terms of ensuring there's no disruption in service delivery when it comes to critical aid, and also looking at longer term issues. With INGO partners, again, it's I think the model has become a business model. We are dealing with an aid industrial complex where everything is monetized. So the same pattern is being replicated even with INGO, local organization partnerships, that the priority when it comes to security risk management becomes training. But training without any resource allocation for local organizations to actually take that training forward. And like we mentioned, a lot of security resources exist, but right now are confined to international frontline workers, or expats that have been deployed. They're not really extended. The duty of care when it comes to NGOs, it doesn't always get extended to local and national actors. And that's something we're challenging, is that even go beyond local partners to even community frontline workers, community volunteers that are engaged, and also playing the role of humanitarian frontline workers.
Thank you. Would you like to answer this one?
As from my notes, the question was about donors and INGOs and how responsive they are to risk management. It's a very big and broad question. I entirely endorse everything that was just said. I'm going to say something slightly different. Firstly, you can ask that question of the different levels of within an organisation, because my experience is that you often find very good managers and very good team leaders within organisations who will go above and beyond and out of their way to support their staff and take their pastoral responsibilities very seriously, even when an INGO or the lead organisation doesn't have that within their mandate. A lot of the best work is done in these grey areas. It's personal initiative. That's not to say that acknowledgement at a higher level and the funding that all my colleagues here have talked about is not important, because it absolutely is. But a lot of this is about attitude and support and shift, particularly at managerial level, and equipping people who actually are very concerned about their staff and work extremely hard to take their pastoral responsibilities seriously, making sure they're actually equipped to deal with distress and trauma, rather than finding those conversations frightening and difficult and to be avoided. The other, I think, challenge to break down to your question is to take the concept of risk itself and how that is fundamentally changing and very, very fast. We've talked a lot here, Mr. Mandali talked about frontline workers a lot, and that is classically how we understand risk. It's people in conflict environments who are in the field. Now, historically, we've actually become quite good at managing that kind of risk. We do hostile environment training, we have conversations like this, it's at least part of the discourse. Certainly in my world of psychological risk management, that profile is fundamentally changing, particularly being driven by Ukraine and by Gaza. The consequence of digital exposure to content from war zones means that risk can now be anywhere. If your job is to monitor what is happening on the front line in the West Bank right now, you could be sitting in Washington, Nairobi, New York, Geneva. If you're looking at that content 8 hours a day, you're going to be impacted by it. It's called vicarious trauma. And there's clinical evidence, significant clinical evidence from many other sectors, particularly social media and journalism, to show that that is a risk on a par with being attacked. What happened to Steve, and I've known him for many years, was awful. And it does happen, and those numbers are increasing. There's no question about that in the data, but they remain rare, actually. And trauma is a rare experience. If you look at a study from 2018, which asked aid workers what they actually found stressful about their jobs, what was impacting their mental health, only 8 out of 200 mentioned traumatic incidents. Traumatic impact comes from a trauma point of view, increasingly from vicarious trauma and exposure, but actually it primarily comes from the way that organisations are run and the way that staff are interacted with. And there is now significant data to show that the aid sector, if you ask people, that is what comes top of the list, what makes our lives difficult. I took the liberty in preparing for this by going to my community and going to my network and saying, what do you want me to say? Because I don't represent an organisation. To quote, in Ukraine, several of us noticed that the internal functioning within the organisation was making people feel worse than the shelling and the bombing. It was the lack of institutional support that did the damage. To give another quote, I think Ms. Harding, you asked earlier about how psychological suffering is regarded. To quote another colleague of mine, after an intensive leadership role for 2 years, I turned down a new role because I said I needed a break. 6 months later, I applied for a different role. HR team informed the hiring manager that I might not be stable because I had turned down going straight from one intensive response to another with no break. Rather than being encouraged to and supported to take breaks between leadership roles in humanitarian settings, this was weaponized and notified in my personnel file. So the stigma remains huge, and the stigma remains not a matter of fear. It remains a very clear personal risk assessment about the implications of disclosing. And this is, in my experience as a therapist, why people do not talk about this subject and why they don't disclose. Instead, as colleagues have already said, they leave the organisation and they leave the sector. So the impact on the quality and retention capacity of organisations is very severely impacted for reasons that are entirely avoidable if they were discussed and managed, because a lot of the risks I've just described actually can be managed. But until we expand our understanding of what risk is, and as colleagues particularly from the field have talked about, understanding what risk mitigation actually looks like when you take a broader understanding of risk, I don't think we're going to get beyond discussing what happens in the very small number of incidents where something obviously traumatic has happened.
So, okay, let me come back to you. If you could just come in, Mr. Novakovic.
Thank you, and I think usefully for you, I'm going to give you a third perspective as well.
Excellent.
And I might even step up a level. And I think this is a particularly useful question given the UK is one of many donors who are pushing to deliver 25% of aid through national organisations. And I think we're at 5%, something like this globally. What's important to understand is the delivery chain at a very basic level. So you have the donor, and then typically they will have a contractual legal agreement with an intermediary, which is typically an INGO, so your Oxfams, World Visions, etc. Then there'll be separate legal agreements between the INGO and a national NGO like Tarini's. what's happening between those is what we would talk about as risk transfer. So a donor will not accept liability for anything that's happening down that chain. And the way that those donor agreements between them and the INGO are framed typically affects how the INGO can be responsive to the needs of a national NGO. At the end of last year, we surveyed our membership, and 60% of the INGO respondents said that they struggled to allocate security resources to their national partners due to the donor restrictions, due to the terms and conditions within that paperwork. And that is, so when you have a situation like that, then it doesn't matter about your best efforts, etc., because then lawyers get involved and they start saying, well, if you do X, you might end up having us absorb liability. And then everything gets chopped up. I think that there's a lack of donor recognition of the partner-specific security needs, and it would be a rarity that you would have direct dialogue. It would be a welcome rarity, but a rarity nonetheless, of direct dialogue between a donor representative and national NGOs to understand their risks, to understand how they needed to operate. Usually, again, you have an intermediary with the INGO. How donors can be more responsive to the security needs of national NGOs is maybe taking a step back from always thinking about, well, how can we just push more money down the chain? Because as Tarini said, a big part of the issue is the grant-based, project-based nature. And in between those projects and those grants, the risks continue and they have an organisation to run. But if the security funding, such as it is, or the overheads are restricted to those, then it's difficult to manage your risk, to build up your long-term capacity, which is what INGOs have done over the last couple of decades. They've gradually built up their security capacities. So rather than simply look at what we can do and what donors can do through that lens, and there is progress to be made. It's also about starting to look at how can national NGOs be treated more like peers of INGOs, simply another part of the system, rather than the bottom of the chain.
So in that, do you have any examples of good practice where it's done well?
I think that there's a couple of initiatives underway at the moment. In fact, a number of my members are working on those. As a representative of the World Food Programme in the observers here, who are working on some new initiatives of different ways whereby the capacity of national NGOs can be built, whether it's around access to shared resources. And I note that Tarini mentioned the concept around pooled resources for HR, etc. And there's some initiatives underway there about pooled resources. Those are usually housed in these NGO coordination forums. So Anna mentioned before the South Sudan NGO Forum. These are quite good avenues where you can direct shared resources. We sent somebody into Lebanon in November last year, when there was the peak of the crisis there, who was made available to work with national NGOs and INGOs on their security contingency plans, etc. So these shared resources, especially given the current global funding constraints, are definitely a positive way forward.
Okay, so I'm just going to push you and turn the question actually on its head. We've already alluded to what I'm going to ask you, but whose responsibility is it to ensure that aid workers are protected and aided in recovery when things go wrong?
I mean, I'm happy to answer.
Sure, I was ready to answer the last question. As I understand it, I'm not a lawyer, but UK employment is very clear that there's a duty of care to provide a safe workplace, and that workplace needs to be safe physically and psychologically. Nobody has tested that in this country in the way that Steve Dennis tested in his case with NRC, which went through the Norwegian system, but I am genuinely really surprised that nobody has done that, because there is that very clear duty of care. So there is straightforwardly a legal responsibility if you are employed, and that's quite aside from the moral and ethical responsibility. There is also a very pragmatic case, as I've said, that if you don't look after your staff, you lose them, they leave. There's a pragmatic argument there from a leadership and an organisational perspective. To answer in part your last question, one person I spoke to as part of my thinking about giving evidence today told me about an organisation they'd worked for who sent them on deployment, this is international staff member, to a remote part of northern Nigeria on a difficult assignment. While she was there, the CEO sent her regular messages asking if she was all right. When she came back to her base station, they sent her a care package to make sure she was all right. That was a small organisation. The work was very difficult. She stayed with them for 4 years longer because she felt cared for and supported. I can quote you other examples of clients I've had. One who was, let's say, forcibly evacuated from South Sudan in a siege situation that took about 10 days to resolve. This is a client, I have her consent to tell this story. The only time her organisation expressed any interest in what had actually happened to her was when the IT department got in touch asking for written confirmation as to why she was unable to return her laptop. There was no other debrief or discourse. So we can sit here and talk about, technical, funded, supported initiatives, but a lot of it, in my experience, comes down to very, very basic things like that, being asked if you're all right.
Just returning to that last example, and thank you for that, where does accountability lie? Because in another kind of organisation, there will be some accountability for what actually happened in that.
Well, she was an employee of an NGO, of a UN agency, and the UN agency system obviously is slightly different because you're outside a national jurisdiction, and I think this is genuinely a complex question when it comes to the legal aspect of who is responsible for somebody. But there's clearly a moral and an ethical responsibility if you pay somebody to put themselves in harm's way, something we choose to do, then there is an expectation on the part of the person who goes into that situation that they won't be thrown under the bus if something happens to them. And that sense of somebody having your back is so critical for people going into these environments in the first place. I think it's a complex question, genuinely, and I know in Steve's case that was part of the complexity. I think that you're right, we do push risk down the line, and we do expect, particularly national staff, in my experience, there is an assumption that because they're national, they're somehow either safer or they are better equipped to handle risk, when actually the risk profile is fundamentally different, as is the kind of support that they require. So back to your point about actually bothering to ask people what they need is helpful. I mean, I'm a therapist. That works well in the UK. There are many parts of the world where the idea of sitting down with a complete stranger and talking about your most intimate problems is a really weird one, and one that frankly just doesn't fly. So to pick up what Steve said, taking a blanket approach to risk management is to ignore the social and cultural needs of people outside our own, what tends to be a very Western framework of what constitutes psychological risk and what constitutes effective mitigation, which again complicates the question of accountability for sure. But to give an example, I worked in Indonesia after the tsunami, and we were quite concerned about the anniversary, the 1 year on, being impactful, because obviously all our staff who are bereaved on multiple levels. The day that turned out to be really significant was the first day of Ramadan, when you mark the loss of the dead. And there were 13 plus mass graves in Banda Aceh, and to meet their religious requirements, our staff had to go and carry out the rituals for their lost loved ones at every single mass grave because no one was sure who was where. My very experienced head of office rather than suggest everybody go to counselling, gave everybody the day off to go and do that, and more time if they needed it. You asked about good practice. I'll refer you to the HAG paper, helpfully published late last year, looking exactly at psychological care for national staff. They look particularly at Bangladesh and Afghanistan. Picking up on Anna's point actually about giving people time off, we have R&R usually for international staff and not for local, but that paper records an example of an organisation in Cox's Bazar which has a policy of offering national staff 2.5 days of paid leave per month to compensate for or to counterbalance the R&R that international staff are offered. That does need funding, mandatory leave. Personally, in my personal experience, peer support networks, buddy systems, you don't need paid psychologists, but people who've got some mental health first aid training, psychological risk management training, who can run informal debrief, end-of-day check-ins, the kind of things that doctors and medics in this country do as a matter of routine. A little bit of training can go a really, really long way in those kind of environments.
Can I just come back to you talked very much about direct dialogue and acknowledgement, actually within the donor country, with the recipient NGO, local, national NGO. In the face of the cuts, training is often the first thing to go, as is dialogue. How do you feel about how the cuts will affect what we're talking about?
I'm glad you asked that question. Do you want to start?
I do want to quickly just touch on your previous question, if I can, on where responsibility lies, because it is very important in how we approach security risk management. And the first level of responsibility is around the enforcement of international humanitarian law, and so it's actually member states have the highest level of responsibility. So, to sum it up, is that aid workers will not be targeted and aid workers will not be impeded. And that is a political issue. It's not for NGOs to deal with. We can shine light on it, etc. But it's relevant to the pragmatically, because the more or less that IHL has observed is the more or less burden that then NGOs have to absorb to keep aid workers safe. So when there's low levels of compliance with international humanitarian law, then it becomes more resource intensive, it becomes more risky, it becomes more complex. And this relates to member states, but also non-state armed groups who are also obliged to comply with IHL. And then I think it's also worth noting, before I come to your question, that donors they're not incentivized to take risk by their own self-imposed rules, because they transfer liability by and large, but they are, this is not to say that they cast us into the wind. There are great initiatives that donors do undertake, but there's no real incentive at a practical level, apart from maybe reputational risk and the success of those programs. But there's no necessarily an incentive beyond that. There's no moral incentive, maybe, to keep aid workers safe. In terms of how the cuts are affecting aid worker security, over the last 20 years, the system to keep aid workers safe, the professionalisation of NGO security has advanced significantly. And then it had another bump after Steve's case, actually, because suddenly that really focused the minds of boards of directors and trustees everywhere. In the short term, and let me preface this by saying that NGO security generally works on the basis of acceptance. So we don't go in with guns and guards and gates anytime we can avoid it. I mean, guns especially, armed escorts are the absolute last resort. We want to be accepted with the community, understand the community, work with them to identify risks. That's important to understand because that is directly affected now when there are large-scale immediate aid cuts, such as the US has implemented, and slightly less acute is longer-term aid cuts that are being highlighted by a number of Western donors. Because in the case of the US, you're having to have conversations with communities saying, oh, we promised that we would do X. We're not going to do that anymore. And then that trust is broken. and is very time intensive and resource intensive to build up again should somebody want to work there. NGOs are having to reduce security staff in highly sensitive areas like Yemen or Sudan. Security is what allows those aid programs to actually get where they need to go and to get to the communities they need to support. We're seeing issues such as with what we call UNHAS, which is the UN's Humanitarian Air Service. So in countries, large countries, conflict-ridden countries, where you need to be able to get safely from point X to point Y, the UN puts on helicopters, fixed-wing aircraft, etc. And in a number of countries, the funding for that is threatened by, I think, is not going to last till the end of March. There's 3 particular countries where that won't be happening. And then finally, in addition to all of these aid cuts, you've got the narratives that are coming with them, and these are not just contained to US funding. This is affecting British funding. The narrative around NGOs are corrupt, NGOs are fraudulent. That is already being quoted back to NGOs negotiating access in Yemen by armed groups. In Niger, anti-NGO narratives have coincided with the military government expelling 2 aid organisations. And then there's a number of other examples I could give you around this where authorities that don't welcome necessarily the presence of pro-democracy organisations or humanitarian organisations are using this as an opportunity to push back and close civic space even further than it was already closed.
Couldn't agree with any of that more. It certainly overlaps with what I've been hearing from people on the ground and in my community. You're right, training is often the first thing to go. This is despite the evidence base being really, really clear. There's very good research from the private sector, actually, a paper the government took action on in terms of the UK policy back in 2019, written by Deloitte about investment in well-being, which actually put a return on investment figure for every pound you spend on well-being and psychological support services for your staff, you get 4 back in productivity. I like quoting that because it's not an advocacy group, that's very hard-nosed private sector analysis. So you can cut the training, but it has consequences. You lose people and you put people directly at risk. So given how cost-effective a lot of these investments actually are, cutting them seems to me a very odd form of economy. When I asked people what they wanted me to talk to you about today, job security came top of the list. I really think it's an issue that most of your written submissions came before current events in America and here in the UK, because the landscape is unrecognisable from where we were. I have colleagues who are realistically, I think, and fairly describing what's happening as an extinction level event across the sector, what that's doing at every single level. I have to relay to you that the feeling against the British government among my colleagues that we expected it from Trump, we did not expect it from this government. So the sense of betrayal is very acute. I think you have a very significant job ahead of you in winning back the trust of the NGO community, and that trust, as you said, is easily lost. It's very hard to win back. You might not hear it when you're talking to organisations because they need your funding, but that is absolutely the feeling. Can we trust them?
We're not the government.
Yes,
I think
that's
know.
just very clear. So that
I completely understand that.
Yes,
I completely understand that. I'm placing this on the record
Yeah.
on behalf of the community that have asked me to do that.
Yeah.
So the challenge ahead of winning back the trust on a macro level, I think, is very significant, but also crucial. I think it can be done. There's a community that is out there seeing opportunity in the cuts, particularly in possibly creating ways that work more directly with local communities. That opportunity conversation is there to be had. But if you're asking about the risk, then yeah, like I said, if you're going to go into hostile environments, you need to know that somebody has your back. And if you think you're going into a hostile environment with a donor who's going to change their mind about their funding with no warning, that is a very significant part of your personal risk calculation about getting involved. The final point I just wanted to make was, about politicisation and community acceptance, because that narrative, particularly coming from the American administration of the tying of assistance to explicit political aims, is something that is really, really frightening people who are on the front line, particularly in conflict-affected countries, who are saying things like, well, what happens when next time I'm in a community and they say, but you're not here to provide aid independently, you're here as part of a conflict effort, essentially. That is a very significant fear among the people in the community that I've spoken to, that the instrumentalisation, moving away from the core humanitarian principle of independence and neutrality, has real practical dangers attached to it for those on the front line.
Can I just push you on the... I will shut up. but can I just push you on the this dismay with the British retreating? How widespread is that?
I think it's... Look, I mean, I've just spent 5 weeks travelling around Southeast Asia. I was in East Timor 3 weeks ago, sitting with he was British by chance, actually, a guy who's was running the a large infrastructure project to bring a sewage system to Dili, which it hasn't had. That's USAID funded. And he was sitting there with his head in his hand saying, I've trained all my engineers, we're ready to go. And now the whole thing's paused. There was unspoken sense around the table, and I heard it from other people, this was in the window, that at least, the Brits aren't going to do that. And then they did. So the terms that have been used to me, and you can see them if you look at the Facebook group I run, terms of moral injury, a feeling of betrayal, that a party that has historically been very supportive, and indeed the architect of DFID, is now not only cutting, which everybody understands. I mean, a lot of my colleagues work on and in Ukraine entirely understand the need to support Ukraine, but the apparent lack of consultation or warning, combined with, and I entirely endorse the Minister's letter of resignation on this, the statement that we can continue to deliver what was promised with the 50% effective budget cuts, is just absolutely nobody buys that. So to see that and think this is a government that thinks that they can be quite so misplaced in their assessment of what it's possible to do with the available funding, I think that has... So there's multiple parts to it. It's not just the lack of funding, it's the way it was done. And I know you're not the government, but that is when you're talking about psychological impact of cuts, I think you can't leave that part out of it. And my heart goes out to the colleagues in the field who are having to go to communities and say we can't deliver anymore, because you've seen it. I mean, if the trust levels aren't there, people would think that their organisations are keeping the money, that they're being lied to, and the security risks then become really significant. The relationship breaks down.
I think if some of the questions that you had for Mr. Novakovic, he has answered. But if we could bring in Miss Ross again, because she hasn't had the opportunity to contribute for a while. And I think, Miss Ross, you're still with us.
Yes, I am.
Yeah, so just going back to a point that Mr. Novakovic touched on, I mean, there have, at least prior to the situation we're in now, been improvements in the way of donors, particularly the AFCDO, and the way that safety is handled. Are you able to speak from your experience to some of those improvements, and also where there is further space for improvement?
Sure. In terms of improvements, I think it's good that there's this issue is we are still having conversations about it. And especially, with the IDC giving space to local actors to share it from their perspective, I think it's brilliant and something that maybe other governments can be encouraged to do. In terms of what more could be improved, so many things. One is like the point I want to re-emphasize in terms of duty of care and liability. We want to look at it a bit differently from the perspective of rights of frontline workers. They're not just volunteers, they're workers as well. Occupational safety is a worker right issue. And for us, we don't even look at it as, formal staff who have contracts with us. It's anyone engaged in the work we're doing on ground, which includes community volunteers. So I think that space for improvement to, look at security risk management and duty of care more holistically about who are the people who are actually playing the role of frontline workers on ground, and how we can extend this responsibility, our responsibility to them. And I think every layer in the chain that John explained has a responsibility in that. It includes local, national actors as well. So we, in terms of the rights part, that's one of the recommendations from our study as well, that can we come up with this bill of rights for frontline workers and look at it from that perspective, that how can that be supported. Other than that, like with the aid cuts that are coming in, bigger organizations that had ICR costs available to them from donors, and they were able to build up reserves. This same benefit is not available for local organizations on ground. So they don't have reserves to manage right now in terms of this sudden decision, in terms of keeping on staff and using their reserve funds to do that. So I think it's something that was committed many years ago, in even the World Humanitarian Summit, but maybe a refocus on that kind of quality funding that includes ICR sharing. That's something donors can maybe include in their budgets to give that kind of flexibility, and also push the intermediaries of funding to include that and share the same with the local national organizations they partner with who are actually on ground. The other recommendation was that can we come up with a global fund? Someone I think earlier said that for donors to pool in this kind of money for frontline workers to access in case they face any incidents. I think GISF is already at the forefront of that. They've been able to put together that kind of fund, and that's something we'd encourage other donors to look at. In terms of donors also investing in the existing pool funds that are there, what we'd encourage is that in this investment, if you can push for at least some security risk allocation within those budgets that would be available as a pool, and also invest in local intermediaries who are doing, even with aid cuts, they do a lot of work non-financially. So it does not stop the work in case such funding decisions are made, and this kind of peer support is available non-financially as well. I think Anna or someone mentioned about having security personnel at local organizations. We understand donors may not be able to do that for every local organization, but you can do that with local consortia and local intermediaries that can maybe pool this support and extend it to all their members. And GISF is actually supporting us to do that as well and access that kind of technical expertise. And I think lastly, it's just for us at all levels to have a perspective change. With security risk management, our priority is not just training, although that may be cut. We are saying that if training is given without resources to actually take the training forward post training, we're not able to really see the outcomes of it. So for us to look at it beyond training, beyond funding cycles, to look at non-financial support that even donors can think of considering and supporting, and again looking at this kind of expense not as an expense or a cost, but an investment in those frontline workers who are risking their lives almost every day to deliver life-saving aid.
Thank you. That's very clear. And perhaps, Mr. Novakovic, if you could just very briefly speak to some of those allocative decisions around how the cost of insurance, for example, influences your members' deployment.
Yeah, absolutely. insurance is one of those necessary evils in life, but it can also be an enabling function. And I think that the insurance question is one of the most black and white examples of how nationally employed staff are treated differently to internationally employed staff. Even the employees of INGOs who are nationally employed are not necessarily going to receive the same level of insurance coverage that international staff will receive. And this is a market problem. This is an economic problem. This is a market problem. I know the UK government's position is that they want to use more market-based initiatives. Well, you can do that not just to drive change. You can also use that to drive a better enabling environment. I think that sort of partnership between the NGO sector, the private sector and government to create the opportunity for appropriate level of insurance coverage, which is then available for national NGOs and nationally employed staff of INGOs, would be an absolute game changer in terms of how aid workers, the duty of care is delivered to aid workers. And that is just one of the potential improvements that the UK government, there is a space at the moment which the US were occupying. There is a space at the moment for the UK to emerge as leaders in aid worker safety and security, without a doubt. Whether it's around, and it's one of those great wins where it's a low investment, high exposure, high impact situation. Scaling improvements like insurance, support to enabling structures, which are, again, these are the coordination forums that have been referenced. These don't cost very much money, and yet they are the pathway to the efficiencies that everyone's looking for now. Everyone's got, how do we do more with less? The UK government still, and yes, people are a bit sad about some of the current decisions, but the UK government has a lot of reputation still and would be a trusted figure to get behind on some of these new initiatives.
Your message loud and clear on that.
Thank you. Sam.
Are we on questions 9 and 10?
Yep.
Yeah, so firstly, just what effect, if any, is the increase in aid worker casualties having on the willingness of staff, be that local or international, to be deployed in insecure environments? And that's to either of you. But we'll start with Mr. Novakovic.
Risks are not new. I think you're going to have to be very, very specific environments. The occupied Palestinian territories, Sudan example, it's generally places where the main risks are coming from member states, which, to be honest, NGOs are very careful with how they operate there anyway. I'm not going to say, I'd say that actually Tarini would probably have a very good insight, and Imogen, who speaks to aid workers, I'll defer to them on that question.
I think there's another way to look at it, which is that people in the aid sector are extremely motivated, as Steve said, and speaking personally as someone who's deployed into very extreme environments, being there and seeing what you're part of actually is hugely rewarding. So there's quite a complex understanding of what is a risk environment, which is actually what is also a very rewarding environment to be working in. I personally went through burnout, for example, after a year in Haiti, but Haiti was a fascinating context in 2010. I really enjoyed my time in the country. What did for me was that the office was 50% understaffed the whole time I was there, so we were working outside our area of competence. But to be a field worker often is hugely rewarding. So you see one of the most significant stresses, according to the research available, after organisational mismanagement or difficulties in the workforce is the sense of being unable to assist. Being somewhere where it's your job to help, but being unable to deliver that assistance for political, financial, geographical reasons. So people, I don't think you'll ever have a shortage of people who are interested in in deploying or wanting to be part of it, but a big part of the analysis for me is somebody going to have my back? And that is where the feeling that no one's standing up for you in the public or policy arena, that aid is fair game and that aid workers, as Steve drew the analogy with the military very clearly, that soldiers who go into danger are lauded, given awards spoken of in Parliament, and everybody is very proud of their work, whereas we had a Prime Minister in this country who described the aid department as a cash point in the sky. So those attitudes do the sense as, does somebody have my back? Does someone understand what risks I'm taking here, why I'm going, what I'm going for? That part of the analysis really does matter. Having people stand up for you is a big part of why you would go in. For national staff, I mean, you've had very eloquent speakers, and I'm not going to speak on their behalf, but the level of commitment and personal satisfaction they get from involvement in their work also is remarkable, especially when they're up against what they're up against in their own lives. In my experience, they get asked, I get asked when I've been managing staff, I get asked for support training in conflict management and negotiation, the kind of thing Anna was talking about. How do I handle difficult conversations? That's the kind of thing, the risk mitigation. If we saw that as kind of risk mitigation work or psychological risk mitigation work, then you've got an extra layer of win for investment in that kind of training. To me, that's a mental health initiative, but it's also a security initiative. It's a practical initiative. It's going to give you better outcomes as well. It's going to measurably improve your deliverability. So looking for these things, I think, as John was saying, that deliver on multiple levels. Certainly psychological risk management is not something to be taken and seen separately. But don't underestimate how powerful it is feeling like, when you are out doing frontline work, that you're appreciated, by whether it's by your manager or by your government.
What if we turn that question around a moment, though, to the level of the sort of NGOs and agencies? We're seeing an increase in attacks on aid workers. I think there is a sense that sometimes there's something quite cynical behind that, which is that if you hurt a few aid workers, you'll get people to pull out of an area. And we have also seen examples around the world where that does happen, where there are sort of no-go areas for a lot of NGOs. Is that something that you're experiencing?
This is a delicate but important topic. There is absolutely a number of incidents of deliberate targeting of aid workers by non-state armed groups, by member states. Healthcare bears the brunt of it, I would suggest. And there's some very good submissions that have been made around that, to that end, of the number of attacks on healthcare and healthcare workers. There are even situations where the aid sector uses what we would call humanitarian notification systems, and these are basically a means of NGOs and UN agencies identifying our staff are here or our staff will be here, and that usually the UN as an intermediary will pass that on to militaries and to member states to say, don't attack these. This is under international humanitarian law. You shouldn't attack these. Recently, in the last 12, 18 months, there are a number of NGOs who are not engaging in those. They have a
they're not doing the deconfliction. They
have a perception that there is even a situation where that information is being used for targeting. Yeah. So that just comes back again to, this is a tool which works fundamentally well. It can always be improved, but the manner in which all actors approach the tool and whether they're using it in good faith, it comes back to that this is a political situation around the enforcement, compliance with international humanitarian law.
And do you think we're reaching a point, though, in those situations where some NGOs and agencies are actually just saying, you know what, we just can't function in this setting anymore because we are a target?
There is a ever-increasing, it's becoming far more frequent, I would suggest, that NGOs are facing the question of, can we manage the risk sufficiently, or do we not respond and leave communities in need? That is going to become a question that is going to be asked more and more often, and you may see these are very mission-driven organisations, and there's always going to be an NGO which has a very high risk tolerance, which will say, stuff it, we'll do it. But that's just, that is a real risk, that you have harder and harder to reach communities. We saw in Afghanistan where you would have clusters of NGOs around Kandahar, around Helmand, and they would be around the airport within a radius. And so we were just going to work with them, these communities, because we can safely access them, but we don't have the resources, the capability to get to the people in need further out. So we talk about these hard to access areas, and those hard to access areas may expand, and the areas within which we can safely operate can shrink. This is very big generalization because every context is so complex and so unique, but if there's less resources, then that's going to happen, and if there's less compliance with IHL, that's going to happen. And ironically, a lot of Western donors who are saying, listen, we're going to cut our aid budget, but we're still going to respond to the most acute crises. Well, guess what? Those are the ones that are hardest to access. That's when there's active conflict, when there's natural disasters, and NGOs aren't necessarily going to have in reserve the capacity to be able to respond to those.
Just to bring our proceedings to a close, I just want to ask you, Ms. Ross, if there's anything further that you would like to say.
Thank you very much. I think just to add on the last point, what we're seeing is, a lot of INGO counterparts have had to, withdraw and close or at least temporarily pause. But we're still seeing active community groups, community-based organizations that will continue their work. And, they'll continue, like Imogen said, it's purely based on passion and really that that service to affected communities. So that will continue. Of course, now they'll be taking more risks because they have to also deal with withdrawal of their INGO counterparts. But yes, with or without funding, community response continues. I think that's what I'd like to emphasize.
Well, thank you very much, Ms. Ross, for your contribution, and to our witnesses here in the House of Commons this afternoon. I now draw this evidence session to a close, and the committee meeting order